Hello, everyone. Today we're going to be looking at stroke and how to answer stroke-related NCLEX questions. All right, so today we're going to be talking about stroke. I'm going to start by giving a brief overview on stroke. And after that, we're going to look at different stroke NCLEX questions. Like we know, strokes are forms of disorders that involve sudden and focal interruption of blood flow to the brain, and these generally will produce neurological deficits. Right. So basically, what's happening in the case of stroke is that the cerebral blood flow has been interrupted, either due to a ruptured blood vessel or due to a thrombus in a blood vessel that has obstructed the flow of blood. And obviously, because some parts of the brain are not getting enough blood supply, which carries oxygen and nutrient, we're going to see some neurological deficits. So there are basically two types of stroke. We have the ischemic stroke, which is the most common form of stroke. 80% of stroke cases are actually ischemic in nature, and this is as a result of thrombosis or embolism. Right? Thrombosis is the formation of a blood clot obstructing a blood vessel, and embolism can be very movable blood clots or foreign bodies that obstruct a blood vessel in their path. So we have hemorrhagic stroke, which is the least common of the two strokes. 20% of strokes are hemorrhagic, and this is as a result of ruptured blood vessels that leads to hemorrhage within the brain. Now, there is a form of ischemic stroke that is called the transient ischemic attack, very similar to the ischemic stroke, except that the symptoms in this case will last less than an hour. Most TIAs actually last less than 5 minutes, right? But most of the deficits that are caused by a transient ischemic stroke resolve spontaneously between 1 to 24 hours, but however, they're still accompanied by an infarction. So any kind of transient ischemic stroke that lasts more than 1 hour to 24 hours is no longer considered transient ischemic stroke. So the only transient ischemic stroke is the stroke that lasts less than 1 hour. Anything over an hour will still cause infarction and damage to the brain cells. And so that will no longer be considered transient, but will be considered a one of the two types of strokes we've seen already. In the United States, stroke is the fifth leading cause of death, and it's the most common cause of neurologic disability in adults. All right. And the arteries that are mostly affected in this case are the anterior circulation and the posterior circulation. And we know that this anterior and posterior circulation communicate through the circle of Willis. Now, there are different risk factors that can increase a patient's chance of having a stroke. Some of these risk factors are modifiable, others are non modifiable. When we speak about risk factors that are modifiable, these are risk factors that can be controlled or managed using medication or lifestyle changes, while the non modifiable factors are conditions that are not that we cannot change, that we cannot alter. There are things that have happened or things that are happening, and we have no way to change them. But we're going to focus first on the modifiable risk factor. Now, hypertension is a very modifiable risk factor. Even though hypertension is a chronic condition without a cure, it can be managed and controlled with medication. So it's modifiable. Smoking is also modifiable because a patient can decide to quit smoking. And so that is something that could be changed. Dyslipidemia and diabetes are all modifiable conditions because they can be managed with medication and lifestyle changes. Insulin resistance, abdominal obesity, obstructive sleep apnea, excessive alcohol consumption, all of these are modifiable. Lack of physical activity is also very modifiable, something we can decide to change by becoming even more active. Okay. Then high risk diets like diets that contains saturated and trans fat are also very modifiable because we can choose to change our diet. Psychosocial stress like depression can also be controlled with medication. Heart diseases like myocardial infarct, endocarditis, and so many other heart conditions are also modifiable because they can be controlled or managed with medication. Hypercoagulability is modifiable, although this is a risk factor that is only specific to thrombotic stroke or ischemic stroke, because hypercoagulation can cause thrombus that obstruct the blood vessels. Also, intracranial aneurysm can be modifiable, okay, with early diagnosis and treatment. This risk is mostly for the subarachnoid hemorrhage, in terms of hemorrhagic stroke, because aneurysms can rupture blood vessels and cause bleeding. The use of some drugs like cocaine and amphetamines are also modifiable, because these people who consume drugs can quit that consumption of drugs with the help of rehabilitation. Anticoagulants and antiplatelets are also modifiable risk factors, and vasculitis too. Non-modifiable risk factors, things that we cannot change, are a patient's previous history of stroke, an advanced age. Age is not something that is changeable. Family history of stroke, race and ethnicity, these are things that are fixed. We cannot change them, and genetic factors too. So these are the non-modifiable risk factors that would increase a patient's chances of having a stroke. Next. We're going to look at ischemic stroke symptoms, diagnosis, treatment, or management. So, for the ischemic stroke, we already know that this is as a result of an obstruction of the blood flow to the brain. What kind of symptoms are we going to see? We're going to see hemiparesis, which is a muscle weakness in the one half of the body, or monoparesis that affects just one extremity, or quadriparesis that affects the four extremities. We're going to
Span
see
coach and NCLEX
hemisensory
coaching.
deficit. We're going to see monoocular or binocular visual loss. We're going to see visual field deficits, diplopia or double vision. We're going to see dysarthria, difficulty articulating words. We're going to see facial droop, ataxia and lack of coordination, vertigo. We're going to have aphasia, and we're going to have sudden decrease in the level of consciousness. These are very characteristic of ischemic stroke. But for us to get to diagnosis, we need to be able to carry out a neurologic examination. And the goal of this neurologic examination will be to confirm the presence of stroke symptoms, like the neurological deficits we've mentioned just now. But also, one goal that we need to achieve with a neurological examination is distinguishing a true stroke from stroke mimics, because there are different conditions that can actually mimic the symptoms of stroke. So we want to be sure that we are actually in the presence of an actual stroke. Also, within this neurological examination, we want to be able to establish a neurologic baseline so that we can easily evaluate the patient's improvement or evolution. And then we also want to establish the stroke severity. In this case, we would need to use neurologic exams and scores to help us determine prognosis and therapeutic selection. Now, what are we going to evaluate in the neurological exam? We're going to evaluate cranial nerves, motor function, sensory function, cerebellar function, gait of the patient, deep tendon reflexes, the language, right? Remember, we're going to see symptoms of dysarthria and aphasia, and we're also going to evaluate mental status and level of consciousness. It's important that we also evaluate the skull and the spine, just to be able to discard meningismus as also one of the possible diagnoses. So, to diagnose an ischemic stroke, it is very important that a CT scan is done. It's the most emergent form of diagnosis we can use. So the most recommended one is the non-contrast computed tomography, right? But we can also do other types of neuroimaging techniques. But the thing we need to take into consideration is that when we are before a stroke, when we suspect a stroke, time is of the essence. So we don't want to waste time doing tests that will not give us results. We want to do a test that will be much more direct and help us make therapeutic decisions. So the first thing to do will be a non-contrast computed tomography. But other neuroimaging techniques that can be done are a CT angiography and a CT perfusion scanning, magnetic resonance, carotid duplex scanning, and even digital subtraction angiography. A lumbar puncture will be required only to rule out meningitis or subarachnoid hemorrhage, especially in the case where we've done a CT scan and the CT scan tells us that this patient does not have signs of a stroke. However, clinical symptoms are telling us this is a typical stroke. So when we are having a um, clashing symptoms or clashing characteristics between CT scan and the clinical symptoms we're seeing, then we might have to do an LP just to rule out the meningitis or hemorrhagic stroke. Aside this, we could also do laboratory tests that will help give us extra information. So we want to do a CBC, complete blood count, that might reveal the cause of the stroke to us. It could be a polycythemia, thrombocytosis, leukemia, and it could also provide us with possible concurrent illnesses like thrombocytopenia if we are considering fibrinolytic therapy. We can also do the basic chemistry panel. This will reveal to us if we're in the presence of a stroke mimic like hypoglycemia, hyponatremia. All right. And or if there are like concurrent illnesses like diabetes, renal insufficiencies that could have led to the stroke. We'll do coagulation studies too to reveal if there are any coagulopathies that are useful, especially when we are thinking of using anticoagulants or fibrinolytic therapy. Toxicology screening will be a great test to do, especially if we suspect that this patient might be intoxicated with drugs or if they are presenting behaviors and symptoms that mimic stroke but might be related to drugs. And then pregnancy testing, obviously, we need to do a urine pregnancy test if we have a female patient of childbearing age who is presenting stroke symptoms. This is very important because if what we're suspecting is an ischemic stroke, then RTPA is a class C agent in pregnancy. It means that studies on animals have shown that RTPA affects the fetus. However, there are not enough human studies to tell us how it will affect a human fetus. All right. So that is also a very important test to do. And when it comes to management, our goal is to make sure that within the first 60 minutes that this patient arrives to us, right, we have been able to access ABC. Right, we have been able to stabilize this patient in relation to ABC. That means airway, breathing, and circulation. And within this first 60 minutes, we also want to be able to complete evaluation and assessment and do our imaging and laboratory studies and start reperfusion therapy if it is the appropriate treatment in this case. Okay, so the therapies we have for ischemic stroke are fibrinolytic therapy to break down the clots and improve blood flow, antiplatelet agents to control and slow down coagulation, and then we could actually need a mechanical thrombectomy if it becomes necessary. Aside this, we'll have to treat comorbid conditions. So we'll have to reduce fever, we'll have to correct hypotension or hypertension, we will have to correct hypoxia, hypoglycemia, manage cardiac arrhythmias, and manage myocardial ischemia. Then, in terms of prevention, stroke prevention will depend on if this patient has had a previous stroke or if this is actually their first stroke. And for that reason, we'll have the stroke prevention divided into two. So, we're going to have the primary stroke prevention, which refers to treatment of individuals with no previous history of stroke. For this patients, we want to give platelets, antiaggregants, we want to give statins, we have to encourage exercise and lifestyle changes like avoiding smoking and reducing alcohol consumption. In the case that this patient has had a previous stroke, then we want to focus all our prevention measures on platelet antiaggregants, antihypertensive medication, statins, and also lifestyle interventions. All right, we're going to move now to hemorrhagic stroke. In hemorrhagic stroke, we already know that there's a rupture of blood vessels, there is bleeding occurring within the brain parenchyma, right? And so, patients who have hemorrhagic stroke or intracerebral bleeding are more likely to have headaches, altered mental status, seizure, nausea, vomiting, or even a marked hypertension compared to people with ischemic stroke. However, these symptoms are not enough for us to say this is a hemorrhagic stroke or for us to reliably differentiate a hemorrhagic stroke from an ischemic stroke. So, in terms of symptoms, for hemorrhagic stroke, we're going to have focal neurologic deficit, and this will depend on what part of the cerebral hemisphere is affected, right? If the deficit occurs in the most dominant part of the brain, the most dominant hemisphere, which for most people is the left, then most of the symptoms we're going to see in this patient is going to be on the right. So we're going to have right hemiparesis, right hemisensory loss, but the gaze preference would be to the left. We'll also have right visual field cut and we'll have aphasia. In the case that the deficit or the damage occurred in the non-dominant part of the brain, which is mostly the right hemisphere,
Stan
then the
codes,
symptoms will be mostly
NCLEX
to the left.
coaching.
So left hemiparesis, left hemisensory loss, the gaze preference will be right, and then left visual field cut. All right, let's move on. So, in terms of diagnosing hemorrhagic stroke, we're going to do lab tests, but again, the most important test or study to do will be a CT scan, the same as ischemic stroke, because we never know for sure if we're before a hemorrhagic or an ischemic stroke. So the first thing is to do a non-contrast computed tomography or an MRI that will help us determine if we are before a hemorrhage or an ischemia, right? And then we could do other tests like the CBC, metabolic panel, and coagulation studies. In terms of management of a hemorrhagic stroke, that would depend on the severity of the bleeding. Obviously, we'll have to make sure that patient is stabilized in terms of ABC, airway, breathing, and circulation. We'll have to carry out basic life support if it's necessary. We need to control bleeding, we need to control seizures, we need to control blood pressure, and obviously intracranial pressure. These are very critical things to do in terms of management of this patient, right? And then in terms of medications to include, we'll have to include an anticonvulsants to prevent seizures, antihypertensive agents to control blood pressure and also reduce other risk factors of heart disease. And also, we'll need to use an osmotic diuretic to decrease intracranial pressure, especially in the subarachnoid space. And potentially, we might need to do a surgical evacuation of the hematoma that results from the bleeding. So basically, this is a very basic, simple overview of stroke just before we go into the questions, just so that we have like a foundation to these questions we're going to be looking at. All right, so we're going to start with our first question. A 72-year-old female patient with a history of a right sided stroke is admitted to the hospital. The patient has left sided weakness and requires assistance with daily activities. The nurse is preparing to provide oral care for the patient and plans to use a padded tongue depressor to open the patient's mouth. Which of the following action is not recommended for oral care in this situation? Option A says laying the patient flat on their back with a small cushion under the head. Keeping suction equipment readily available at the bedside is option B. Option C says using a padded tongue depressor to open the patient's mouth. And option D says brushing the patient's teeth with a toothbrush. Now, the question is which of the following action is not recommended for oral care in this situation? This means that three out of these four options are recommended actions in a patient with a right-sided stroke who needs oral care, and one of them is not recommended. So, which one of these is not recommended? So let's start from option A. Laying the patient flat on their back with a small cushion under the head is not a recommended option. Why? Because in patients with right-sided stroke, it is or with generally with patients with mobility issues, Positioning them on their back is going to increase the chances of aspiration. So the best way to position them is to position them on their side, right, with the head turned to the side so that they can properly drain every secretion that is in the mouth or the throat. Okay, so if we leave them lying flat on their back, then their chances of having an aspiration increases. And the potential signs of an aspiration is persistent coughing, drooling, food pulling from the mouth, and even nasal regurgitation during swallowing. So we don't want to put a patient with mobility issues or limited mobility on lying flat on their back. The best position would be on the side for easy drainage of secretions. B, keeping suction equipment readily available is a very correct action to take because the suction equipment will come in handy if there are secretions that this patient cannot clear independently, and we need to help them with the suction equipment. So that is a very recommended action to take. Using a padded tongue depressor to open their mouth is a very safe way to open a patient's mouth because remember, this patient is going to have some level of paralysis. And then brushing the patient's teeth with a toothbrush is also a correct action. We want to make sure that we encourage hygienic activities in this patient. We want to make sure that they know that hygiene is a priority, and when they are able to carry out these hygiene activities, they must know that they are encouraged to do so. So the answer here to this question is option A. It is the action that is not recommended for oral care in this situation. Let's move to the next question. A 64-year-old patient with a history of high blood pressure is brought to the emergency room with sudden right-sided weakness, facial drooping, and trouble speaking. What is the most critical nursing action to take first in managing this patient? Number one, get ready to administer recombinant tissue plasminogen activator, RTPA. B, inquire about what might have triggered the symptoms. C, order an immediate CT scan of the head. And D, contact the speech therapist for an urgent consultation. Now, the question is saying which is the most critical nursing action to take first in managing this patient. Okay, so this is a patient that has come with a history of high blood pressure. They have facial drooling, right side weakness, very characteristics of a stroke. Characteristic of a stroke. So, what's the first thing we do? We want to get ready to administer recombinant tissue plasminogen activator. That option is false because we cannot administer RTPA without knowing what kind of stroke this patient has. Remember, if this patient has a hemorrhagic stroke, then RTPA is contraindicated in that case. So the first thing we want to do is not to administer recombinant tissue plasminogen activator. So option A is false. B, inquire about what might have triggered the symptoms. Yes, it's important for us to know what triggered the symptoms, but that is not our priority. Okay, we're trying to figure out the most critical nursing action to take. All right, so we're prioritizing here. Also, remember that this patient is going to be having paralysis and difficulty speaking. So, trying to inquire about what triggered the symptoms is a waste of time. We can do that later by asking family members. C. So, B is wrong. Option C, order an immediate CT scan of the head. That is correct. Remember, we've seen the overview of
Stancoast,
stroke, and the
NCLEX
first thing
coaching.
we have to do in every case that we suspect is a stroke is to do a CT scan. It is the one way we can differentiate if it's a hemorrhagic stroke or an ischemic stroke to decide immediate treatment. So the correct answer here is option C. Option D says contact the speech therapist for an urgent consultation. That is a very important thing to do, but that would be secondary. In this acute phase of symptoms, we do not need to contact the speech therapist at all. So, correct answer here is option C. Next question. A client arrives in the emergency department with an ischemic stroke and receives tissue plasminogen activator administration, which is the priority nursing assessment in this case. So option A says Time of onset of current stroke. Option B says comprehensive physical examination and history. Option C says list of current medication. And option D says scheduled surgical procedures. So let's start with A. Option A, time of onset of current stroke is our priority here. So that's the right answer. Why is it our priority? Because RTPA is most effective if administered within the first 3 hours of the onset of symptoms. So we want to know when the stroke symptoms started so that we make sure that we are working in the benefit of the patient in order to administer RTPA within that window that we have to administer it. Obviously, option B, comprehensive physical examination and history is very important, but that is not the priority in this case. Option C, list of current medications. Yes, we want to know what medication this patient is taking, but again is not our priority. And schedule surgical procedure, that is a secondary action to take. It's not the most important thing now. The most important thing in this patient is knowing the onset of the current stroke. Next question. In the first day following thrombolytic therapy for an ischemic stroke, the primary focus should be on managing the patient's A, heart rate, B, breathing, C, blood pressure, and D, body temperature. So we're going to look at these options. We have 4 options, all of which are very important within the first 24 hours, right? We want to make sure that we are on top of the vital sign monitoring. But of all these vital signs, one of them is the most important, and the correct answer here is C, which is blood pressure. So we want to monitor blood pressure because this is critical due to the risk of intracerebral hemorrhage, which could be one of the adverse effects of a thrombolytic therapy. All right, so blood pressure should be kept within normal range, especially within the range indicated by the treating physician and also tailored to the patient's needs. So, the most important thing we want to do in the first 24 hours is actually to control blood pressure. So we have to, in the first 2 hours, we have to make sure that we're controlling blood pressure every 15 minutes. And in the next 6 hours, we want to make sure that we're controlling blood pressure every 30 minutes. And in the next 16 hours, we want to make sure that we're controlling blood pressure every hour. Heart rate, breathing, and blood temperature, body temperature are also very important. But the most important of the 4 of them is the patient's blood pressure. Next question. What is the most critical nursing assessment within the first day after a patient is admitted with a thrombotic stroke? A. Measuring HDL levels. B. Checking pupil size and reactivity. C. Evaluating bowel function. And D. Performing an ECG. All of these follow-ups, right, are very important. Checking HDL levels, all of that is important. But the most important here that we need to take into consideration within the first day of a patient admitted with a thrombotic stroke is checking pupil size and reactivity. Pupil size and reactivity is related to cranial nerve function. So we're looking at the optic nerve, cranial nerve 2, and the oculomotor nerve, cranial nerve 3. Any alteration in pupil size and reactivity tells us that cranial nerves have been affected, and that is a very important thing to note because it tells us if the brainstem is intact or not. So the first thing we want to do is check constantly for pupil size and reactivity. Performing an ECG, option D, is not necessary in this case. Evaluating the bowel function, obviously we don't want ileus and constipation, but our priority is the pupil size. And so the correct option here is option B. Our next question says, what is the primary goal of administering thrombolytic agents? Now, The options are option A, enhancing blood vessel permeability, B, promoting blood vessel constriction, C, breaking down blood clots, and D, reducing the risk of bleeding. So we're talking about thrombolytic agents. Thrombolytic agents, remember, are used only for ischemic stroke. All right. So we want to enhance blood vessel permeability, yes, because we have in an ischemic stroke we have a thrombus obstructing blood flow. So we want to obviously enhance permeability, but that's not the direct goal of a thrombolytic agent. Option B, promoting blood vessel constriction, that goes against what we're trying to do. We're not trying to obstruct the blood flow more, we're trying to create space for blood to flow. So option B is not an option. Breaking down blood clots is the exact function of thrombolytics. They break down clots, they break down the thrombus that is obstructing the blood vessel, creating passageway for the blood flow. So the correct answer here is option C. Reducing the risk of bleeding is not what thrombolytics do. Thrombolytics focus on blood clots. Anything that will reduce the risk of bleeding will be much more tailored to hemorrhagic stroke, right? So the correct answer here is breaking down blood clots. Question 7. A patient with a history of atrial fibrillation recently experienced a transient ischemic attack TIA. Which medication is most likely to be prescribed for this patient upon discharge? All right, so it's important for us to note that this patient has been treated and the patient is about to be discharged, and we want to know what medication should be given to them upon discharge. Right. So number one is anti-gout drug. Number two, oral anticoagulant. Number three, thrombolytic agent. And number four, a beta blocker. Let's look at the options one by one. Option A, anti-gout drug, is not an option here because this patient does not have gout. This patient has had a TIA. So an anti-gout drug here is not going to be useful to this patient. An oral anticoagulant is the correct answer because oral anticoagulants such as warfarin will help control coagulation, and also they are also recommended in patients with atrial fibrillation to reduce future formation of thrombi, right? Because what has happened here, we're talking about an ischemic attack. A thrombus has been formed within the blood vessel. We're trying to prevent future formation of thrombus, so we're going to have to use an anticoagulant to slow down coagulation and prevent this risk. C, a thrombolytic agent, is not correct because the question says upon discharge, not the acute phase. If for any reason an antithrombolytic agent is needed for a TIA, then it will be administered during the acute phase. It is not administered upon discharge. And beta blocker will help control heart rate and blood pressure, which is fine, but it is not directly what this patient needs to prevent further thrombus formation in the future. So the correct answer here is option B, an oral anticoagulant. Next question. The next question says, which individual is at the highest risk for a stroke? Number one, a 30-year-old pregnant woman. Number two, a 66-year-old Caucasian man. Number three, an 80-year-old Japanese woman. And number four, a 54-year-old African American man. So generally, we'll have to look at which one of these people has the highest risk for a stroke. So, based on studies, men have a higher risk than women in terms of stroke, except maybe in the old age, but mostly men have more risk of having stroke than women. So, we can comfortably say that option one and option three are out of the question. This women's risk will definitely be lower than the men's risk. So we have two options left, option two and option four, the Caucasian man and the African American man. Now, African American men have twice the risk of having stroke than any other race or than Caucasian men. And this is also because African American men have a very high risk of hypertension. So their chances of having a stroke will definitely be higher than Caucasian men. In terms of Caucasian men or Asian men actually have a lesser risk of having stroke because of their lifestyle, their diet, which is very rich in omega 3 fatty acids. So the correct answer here will be the 54-year-old African American man. Also, in this question, it's important for us to know that pregnancy has a very minimal risk of stroke. So, a pregnant woman in this case will not have the highest risk of a stroke because pregnancy has very, very minimal risk. Question 9 says, which action by an unlicensed assistive personnel assisting a patient with right sided paralysis would require the nurse to step in? All right. So option A is using a gait belt to assist the patient in walking. Option B says positioning the patient on their back with their head turned to one side. Option C says helping the patient move in bed by placing a hand on under their right armpit. And D, encouraging the patient to perform daily living activities on their own. Now, this is a very important question because we are talking about situation in which a nurse will have to intervene in the case where an unlicensed assistive personnel is taking care of a patient or assisting a patient. So using a gait belt to assist the patient in walking is good. We want to encourage early walking and this will help improve movement and muscle strength. So that is a correct action to take, and the nurse will not need to intervene in that situation. B, positioning the patient on their back with their head turned to one side is also a very correct action to take in this case. Remember, we've talked about this that having the patient's head turned to the side will reduce their risk of aspiration. So, putting the patient in this position is a very correct action to take, and the nurse will not need to intervene. Option C says helping the patient move in bed by placing a hand under their right armpit. Now, in this case, the nurse will definitely need to intervene because we have been told that this patient has a right sided paralysis, and because of that, they are prone to dislocation. So, we should never try to move or reposition such patients by putting our hands under the armpit, right? By pulling them by the hand that is paralyzed because we can risk a dislocation. Rather, we can reposition them by supporting their shoulder blades, or we can use a lift sheet to reposition them, and that way we don't risk causing more damage to this patient. So the correct answer here is option C. If the unlicensed assistive personnel were placing their hand under the right armpit of this patient in order to move them, then the nurse should definitely intervene. Option D says encouraging the patient to perform daily living activities on their own. This action is very correct. The nurse will not need to intervene because we want to encourage the patients to do activities on their own. That way, we can improve their self esteem and also fasten recovery in these patients. Question 10. A patient hospitalized with a subarachnoid hemorrhage experiences severe headache, neck stiffness, and intense vomiting. Under which condition should a lumbar puncture be avoided for this patient? A. Persistent vomiting. B. Elevated intracranial pressure. C. Requirement for mechanical ventilation. And D. Presence of blood in the cerebrospinal fluid. So, which one of these situations will require that we avoid doing an LP? Option A says persistent vomiting. Now, persistent vomiting is not a typical sign of increased intracranial pressure. So we can actually do an LP in a patient that is
Stancoast, NCLEX
vomiting.
coaching.
All right. What we're looking for in such patients is any sign that intracranial pressure is increased or lesions on the site of the puncture or even very low blood platelets or recent use of blood thinners. These will be contraindications for an LP, but persistent vomiting is not a contraindication. The next option says elevated intracranial pressure. This is the correct answer. increased intracranial pressure is a contraindication for LP, because if we do an LP in a patient who has increased intracranial pressure, we can cause brain herniation, which is fatal. All right, so in this case, a CT scan will have to be done to discard that the presence of an ICP, increased ICP, before we proceed to do an LP. Now, signs that there is an elevated ICP in a patient will be altered mental status, focal neurological deficit, seizures, swelling of the optic nerves. All right. Any of these signs would make us think of an increase in intracranial pressure. So that's the only case where LP is prohibited. C, requirement of a mechanical ventilation. A patient on mechanical ventilation is not prohibited from having an LP, so we can comfortably do LP for a patient with mechanical ventilation. The presence of blood in the CSF. Now, the presence of blood in the CSF will help confirm a subarachnoid hemorrhage, and is also essential for diagnosing conditions like meningitis. Actually, identifying blood in the CSF means that an LP has already been done. So that will not be a contraindication for LP. The only contraindication for LP in this option is an elevated ICP. So option B is your correct answer. Question 11. A patient with a subdural hematoma becomes agitated and confused with dilation of the pupil on the same side as the injury. The doctor prescribes Mannitol. What is the primary reason for this medication? Number one, to lower eye pressure. Number two, to prevent kidney damage. Number three, to induce osmotic diuresis and reduce intracranial pressure. And last option is to pull water into the bloodstream and elevate blood pressure. I feel like for this question, you either know it or you don't. So we want to know, what does mannitol do? Mannitol does not directly act on eye pressure. It does not directly act on the kidney, on preventing kidney damage. But mannitol increases osmotic pressure, and this osmotic pressure causes osmotic diuresis. How does it do this? By pulling the water, the excess water in the brain cells, into the bloodstream, and this is eliminated through the kidneys. And by so doing, it reduces ICP. All right. So the main function of mannitol is to induce osmotic diuresis and therefore reduce ICP. Option D, to pull water into the bloodstream and elevate blood pressure. Mannitol will not do that. So the primary reason for mannitol is option C. That is your correct answer. Question 12. A patient with a subdural hematoma is administered mannitol to reduce ICP. Which of the following outcome indicates that the mannitol is effective? Again, this is related to the question we have just seen about mannitol. So first option is increased urine output. Number two is pupils are 8 millimeter and non-reactive. Number three, systolic blood pressure remains at 150, and option four, BUN and creatinine levels normalize. So again, mannitol works by producing osmotic diuresis, which means that if it's draining all the liquid from the excess liquid from the brain cells into the bloodstream to eliminate them through the kidneys, it means that there will be an increase in urine output. So the correct answer here is option A. Mannitol does not will not cause the pupils to become non-reactive, or measure 8 millimeter. It will not keep systolic blood pressure at 150. It will not necessarily affect BUN and creatinine levels, but it will definitely increase urine output, because that's how it reduces ICP. So your correct answer here is option A. Our next question is, which of the following is a normal value for intracranial pressure ICP? So in this question, again, you either know it or you don't. If you don't know it, there is no way to guess the right answer. But even if you do not know the answer to this question, as a nurse or as a student nurse, you should know at least that option D is incorrect. because we have option A that says 0 to 15 millimeter mercury. We have option B that says 25 millimeter mercury. Option C that says 35 to 45 millimeter mercury. And option D that says 120 over 80 millimeter mercury. So why is option D wrong? It's very obvious. Option D is talking to us about the blood pressure. The question is asking about intracranial pressure, not blood pressure. So option D is obviously wrong. Even if you do not know the answer, at least you know that you're not going to pick option D as an answer. Also, in ICP, the normal value of ICP is not 35 to 45, it's not 25. The correct answer here is option A. ICP, normal range of ICP is from 0 to 15 millimeter mercury. Anything higher than 15 is a risk of increased ICP. All right, so correct answer here is option A. Question 14. What symptoms might a patient exhibit with phenytoin level of 32 milligram per deciliter? Now, we have option A, lack of coordination and confusion. We have option B, sodium deficiency. Option C, generalized seizure. And option D, loss of bladder control. So it's important for us to know what phenytoin does. Phenytoin is to control seizures, right? The normal value of phenytoin should not be more than 20 milligram per deciliter. Generally, it ranges between 10 to 20 milligram per deciliter. So anything above 20 milligram per deciliter is phenytoin toxicity. And phenytoin toxicity will actually cause symptoms of ataxia and confusion. So lack of coordination and confusion. So our best option here, the correct answer is A, lack of coordination and confusion. Phenytoin will not affect sodium efficiency. It will not cause generalized seizure because it actually controls seizures, and it will not cause loss of bladder control. So the correct answer here is option A. And the last question for this part, which of the following signs would be the earliest indicator of increased intracranial pressure following a head trauma? Number one, slow heart rate. Number two, excessively dilute urine. Number three, agitation and disorientation. And number four, increased difference between systolic and diastolic blood pressure. So we've talked about increased intracranial pressure when we were talking about LP prohibitions. So we know that we cannot do LP in intracranial pressure because of the risk of brain herniation. But the symptoms of ICP, the first symptom of ICP, very characteristic, is the altered mental state. We will also see focal neurologic deficit. We're going to see seizures and swelling of the optic nerve. But the first symptoms we're going to see will be altered mental state, and that can be expressed in the form of agitation and disorientation. So the sign that would be the earliest indicator of increased ICP would be option C, agitation and disorientation. Slow heart rate is not necessarily the earliest indicator. Excessive dilute urine, not necessarily related to increased ICP. Increased difference between systolic and diastolic blood pressure, again, not correct. The correct answer here is agitation and disorientation. So that is what we have for today for the first part of stroke NCLEX questions. Difficulties with memory and learning are most likely associated with which brain lobe? Option A, frontal, option B, occipital, option C, parietal, and option D, temporal. Now, the frontal lobe is generally focused on processing attention or anything attention related. The occipital lobe, like we all know, is for visual processing. The parietal lobe, on the other hand, helps with language processing and proprioceptive stimuli response. And then the temporal lobe actually focuses on memory and learning. So the correct answer for this question will be option D, the temporal lobe. Next question seems to be very related to the first one. So, a client cannot sense the heat from a hot oven. which brain lobe might be impaired? Frontal lobe, occipital lobe, parietal lobe, and temporal lobe. So, as we've said in the last question, the parietal lobe focuses on language processing, proprioceptive stimuli, and so it also responds to, it also deals with sensory response. So, anything related to temperature will be the function of the parietal lobe. So, the correct answer here will be the parietal lobe, since this patient is unable to sense the heat from a hot oven. So that will be a sensory function that has been affected. We'll go to the next question. To assess motor function in an unconscious patient, which methods should a nurse use to test peripheral pain response? Rubbing the sternum. Option B, applying pressure to the orbital ring. Option C, squeezing the trapezius muscle, and option D, pressing on the nail bed. Now, if we have an unconscious patient, we can evaluate this patient's response to pain, either their response to peripheral pain or their response to central pain. Now, depending on if we are testing for response to peripheral or central pain, the methods will differ. So, for central pain response, we're going to use the rubbing of the sternum. We're going to use applying pressure to the orbital ring. We're going to use squeezing the trapezius muscle, and we're also going to use pressing on the earlobe. So those are 4 methods to check for pain, central pain response. In the case of peripheral pain response, there are two methods. One is pressing on the nail bed, and the second is pinching the inner arm or thigh. Now, the question says, method, which method will be used to test for peripheral pain response? So the 4 options are all for testing for pain response, but the only option here that is used to test for peripheral pain response is option D, pressing on the nail bed, because option A, B, and C are used to test for central pain response. So the correct answer here is option D. Next question. For a lumbar puncture, how should the nurse position the patient? Now, this is a very interesting question. Option A says lying on the side with legs pulled up and head bent forward. Option B says lying on the side with a pillow under the hip. This question, which every nurse or student nurse should know. Watched any medical series at all, or if you've ever done any clinical rotation in a hospital, you know that LP is not done with the patient facing down. Okay, so option C and option D are out of the question, and LP will never be done with the patient lying face down. Option B says lying on the side with a pillow under the hip. That is not also correct. We do not need a pillow under the hip because that would change the posture of the patient and can make it difficult for the LP to be performed. The correct way to do an LP is to have the patient lie on the side with their legs pulled up and their head bent forward. So our correct answer is option A. Why? Because this position opens the spaces between the vertebra and allows for adequate and easy LP to be carried out. So correct answer here is option A. Our next question says, a nurse is involved in assessing an unconscious patient using caloric testing for the oculovestibular reflex. Cold water is injected into the left ear canal. The patient's eyes move slowly towards the left, followed by quick movements to the right. What does this indicate? Option A says a lesion in the brain. Option B says a lesion in the temporal lobe. Option C says a functioning brainstem. And option D says brain death. Now, I think that for you to be able to answer this question, you need to at least know what a caloric testing is, and you need to at least know what a caloric testing is for. All right. So, a caloric testing actually helps to distinguish between a cerebellar or brainstem lesion. Okay. So, a caloric testing involves administering or applying or injecting cold water into one ear at the beginning. We start with one ear and we can do it on the second ear. So injecting cold water into one ear, and the correct response for a patient who has functioning brainstem, whose brainstem is not damaged, the correct response is for both eyes to move slowly to the side that was irrigated. So that will mean moving to the left if the left ear was irrigated, and moving to the right if the right ear was irrigated. So the response, normal response, is for the two eyes to move slowly to the part that was irrigated and then move quickly back to the opposite side. That will tell us that the brainstem of this patient is functioning. So, looking at this question, this patient was irrigated in the left ear and both eyes moved slowly to the left and then moved quickly back to the right. That is the normal response we're expecting from a patient that has a functioning brainstem. So, option A is not the correct answer because the lesion in the brain will not cause the movement that the conjugate eye movement that we've just seen. A lesion in the temporal lobe will also not cause a normal response to caloric testing. C, a functioning brainstem is the correct answer because this patient is presenting a correct, the adequate response to a caloric testing. It means that their brainstem is functioning. And in the case of option D, a patient that is brain dead will not even have any eye motion. So we would not even see this response in a brain dead patient. So a brain dead patient. So the correct answer here is option C. Now let's move to the next question. The next question says that while caring for a patient with increasing intracranial pressure, which trend in vital signs should the nurse expect to observe while caring for a patient with increased ICP? Okay. Now, option A says rising temperature, pulse, and respiration with decreasing blood pressure. Option B says rising temperature and blood pressure with decreasing pulse and respiration. Option C says dropping temperature and blood pressure with increasing respiration and pulse. And option D says dropping temperature with increasing pulse, respiration, and blood pressure. Now, we've already learned so much about intracranial pressure in the last part that we did. And when a patient is presenting with increased intracranial pressure, there is a triad that is formed, and this is called the Cushing Triad. The Cushing Triad is characterized by increase in blood pressure, decrease in pulse or heart rate, and altered respiration, which means respiration could be high or low. Okay, could be increased or decreased. So that is a triad: increased BP, reduced HR, and altered respiration. Now, a patient who is having an increase in ICP that presents with this Cushing triad indicates to us that the ICP, elevated ICP, is severe, that this patient has a risk of having a brain herniation. All right. So this response that we see as the Cushing triad is the body's way of responding to the increased intracranial pressure. So the increased intracranial pressure will lead to an increase in the blood pressure so that the brain can continue to receive blood supply. Then also it will, as a reflex mechanism, produce bradycardia, right, which is reduced heart rate. And because of the pressure placed on the brainstem, we're going to see altered respiration. So for us to choose the right answer here, we want to identify which one of these options has the Cushing triad. So let's start with the blood pressure. The Cushing Triad tells us that the blood
Hypothalamus.
pressure in a patient having an increased ICP will be high. So we're going to look for the option that doesn't indicate a high blood pressure, and then that option we're going to take it out. So if we look at option A, it says that this patient will have a rising temperature, rising pulse, and respiration, but reduced blood pressure. We now know that that is wrong because Cushing's triad tells us that the blood pressure will be high. So A is out of the question. Option B says blood pressure will rise, so we'll keep B in the game. Option C says that blood pressure will drop, so we're taking out option C. And option Option D says blood pressure will be high, so option D stays. So we're taking out option A and option C because they both tell us that blood pressure is dropping, which is not correct according to the Cushing's triad, right? Now we're left with option B and we are left with option D. Let's see which of these two options complies with the second characteristic of the Cushing triad, which is reduced pulse. Option B says that temperature will be high, blood pressure will be high, and pulse will be reduced. So that's correct. But option D says temperature will be low and pulse will be high. That is a lie because that's not what the Cushing triad says. So we can comfortably take out option D and we're left with option B, which is the correct answer because it complies with the Cushing's triad. It tells us of an increasing BP, a decreasing pulse, and a decreasing respiration. Remember that altered respiration can be either increasing or decreasing respiration. So the correct answer here is going to be option B. Now let's move to the next question. A nurse is evaluating a patient post craniotomy for signs of meningitis. Which symptom would suggest the patient is developing meningitis? One, the first option says a negative Kenning sign. B, a positive Brudzinski sign. C, no nuchal rigidity. And D, a Glasgow Coma Scale of 15. Now, when we talk about meningitis, we have three important signs that we have to look out for that are very characteristic of meningitis. So one of these signs is a Kenning sign, a positive Kenning sign. This is basically when a patient suffers resistance and intense pain when their flexed knee is extended. Okay. And then we also have the Brudzinski sign. This is where when we flex the patient's head to the patient's neck, they involuntarily flex their legs too. So that is a positive Brudzinski sign. And then the third sign for meningitis will be nuchal rigidity. So there'll be rigidity with moving the neck. This means that option A is wrong because for meningitis, Kenning sign will not be negative, it will be positive. Option B is correct because in meningitis, Brudzinski sign is positive, so that is our correct answer. Option C is wrong because in meningitis, there is nuchal rigidity. And option D is wrong because a Glasgow Coma Scale score of 15 is a normal patient who does not have any meningeal irritation or neurological deficit. So the only answer here that fits with meningitis is option B. Okay, now let's move to the next question. A patient waking from a coma repeatedly says, just stop the pain. The nurse knows the body's first automatic response to pain is to A. Tolerate the pain, B. Decrease perception of pain, C. Move away from the pain source, and D. Divert attention to from the pain source. Now, I feel like this question is very easy to answer. If you have ever touched something hot, maybe a hot pot, a hot spoon, a hot water, the first thing you do is remove your hand because that's your body's first automatic response is to move away from the pain. I don't think there's anybody who has touched a hot object and left their hand on that hot object. The first thing you do when you touch something hot is to remove your hand. It's a normal reflex of the body. It's an automatic response that you cannot control. Now, this is the brain's way of helping you prevent injury from that source of pain. All right. So tolerating the pain is not the first thing that your body will do. It is not the first response that your body will produce. The decreasing perception of the pain is also not the first automatic response that your body is going to produce. C, moving away from the pain source is the correct answer because that is the first automatic response your body will produce. And D, diverting attention from the pain source, that is a very conscious coping mechanism. So it is not automatic at all. The correct answer here is option C, which is moving away from the pain source. Now we're going to move to the next question. During the acute stage of meningitis, a 3-year-old child is restless and irritable. Which of the following would be most appropriate to institute? 1. Limiting conversation with the child. B. Allowing the child to play in the bathtub. C. Keeping extraneous noise to a minimum. And D. Performing treatments quickly. Now, if you know anything about acute meningitis, it is the fact that patients with acute meningitis are very hypersensitive to loud noises and bright light. So, an environment that has loud noises and bright lights will exacerbate the irritability and even lead to a seizure. So, the first thing we want to do here is to keep extraneous noise to a minimum. Make sure that the environment is calm enough for this patient in order to help them feel less irritable. And that answer is option C. Why is it not option A? There's no need for us to limit conversation with the child. We can have conversations with the child, but in a very, very gentle and soft way. B, allowing the child to play in the bathtub is not really a sensible thing to do because that could overstimulate them and cause more irritability. So this child can be bathed gently by their parent, but there's no need for the child to play in the bathtub. And then D, performing treatments quickly. That is very unethical because you want, as a nurse, you want to administer proficient and efficient treatment to your patient. And that means taking your time and doing the job correctly, not rushing through it, especially in a child that is 3 years old. So D will be unethical. The correct answer here is option C. Now, let's move to the next question. Which of the following would lead the nurse to suspect that a child with meningitis has developed disseminated intravascular coagulation? Option A says hemorrhagic skin rash. Option B says edema. Option C says cyanosis. And option D says dyspnea on exertion. Now, a disseminated intravascular coagulation is a coagulation problem, obviously, which is characterized by abnormal blood clotting and bleeding. So, a hemorrhagic rash is very specific, is very common in cases of DIC. Hemorrhagic rash like petechia and purpura are very common in DIC patients. This indicates to us that there is a spontaneous bleeding into the tissues. Okay, so the correct answer here will be option A, hemorrhagic skin rash. Now, option B is not the answer because edema generally talks about fluid imbalance, and this is not specific to DIC. Cyanosis talks about lack of oxygen, and this is not specific to DIC. And dyspnea on exertion can happen in many conditions, so it is not something that is specific to DIC. The correct answer here is option A. And remember that this hemorrhagic skin rash will be in the form of petechia or purpura. Next question says, when interviewing the parents of a 2-year-old child, a history of which of the following illnesses would lead the nurse to suspect pneumococcal meningitis? The first option is bladder infection. The second option is middle ear infection. Option C, fractured clavicle. And option D is a septic arthritis. Now, it is very common in children for a middle ear infection, otitis media, to cause a pneumococcal meningitis. And this is because of the route, okay, because they can spread, the bacteria can spread from the ear to the meninges. This is a very common route in children. Another route that is common in children is through sinus infection and also direct extension from nearby structures. So in a child, it's very common to see middle ear infection leading to meningitis. Okay, bladder infection is wrong because a bladder infection will not typically cause pneumococcal meningitis in a child. Option C is also wrong because a fractured clavicle really has no relationship with a pneumococcal meningitis, and a septic arthritis is not a common cause of pneumococcal meningitis. So the correct answer here is the middle ear infection. We are going to move to the next question. The nurse is assessing a child diagnosed with brain tumor. Which of the following signs and symptoms would the nurse expect the child to demonstrate? Select all that apply. Now, this is a different type of question because this is not our typical multiple choice 4 option question. This is a question where you have to select all that apply, which means you'll have to select more than one option. So option A says increased appetite, option B says vomiting, option C says polydipsia, option D says lethargy, option E says head tilt, and option F says increased pulse. Now, this question can be a bit tricky because you do not know how many you're supposed to choose, but you need to choose as many that apply to this patient's diagnosis. So if you know a brain tumor and the characteristics of a brain tumor, then you would know which of the symptoms apply. So generally, in a patient with a brain tumor, vomiting, lethargy, and head tilt are very common symptoms, okay, especially in children with brain tumors. And this is because of an increased intracranial pressure or the location of the tumor, right? So, vomiting is going to be very common in this patient. We're going to see lethargy in this patient too as a result of pressure on the brainstem. And then the head tilt also indicates that a tumor is affecting the brainstem or the cerebellum. So, 3 things you would see in a child with brain tumor are vomiting, lethargy, and head tilt. So, our answers here are B, D, and E. The truth is that in a patient with cancer, it is very unlikely that they'll have an increased appetite. So that should not even be considered. Polydipsia is more on more related to metabolic disorders. So there is no reason why we should see that in a patient with brain tumor. And an increased pulse is really not a typical symptom of a brain tumor. So the very typical symptoms, at least vomiting, you should be able to choose that because most cases of cancer come with vomiting and lethargy. So at least you can be sure to choose those 2 options. But the correct options here are vomiting, lethargy, and head tilt. Now let's move to the next question. Question 28. A lumbar puncture is performed on a child suspected of having bacterial meningitis. CSF is obtained for analysis. A nurse reviews the results of the CSF. CSF is cerebrospinal fluid, right? The nurse reviews the result of the CSF analysis and determines which of the following results would verify the diagnosis. So this is a bacterial meningitis. Basically, the question is telling us what would you see in the CSF if you do an LP in a patient with bacterial meningitis. So option A says a cloudy CSF, decreased protein and decreased glucose. Option B says cloudy CSF, elevated protein, and decreased glucose. Option C says clear CSF, elevated protein, and decreased glucose. And option D says clear CSF, decreased pressure, and elevated protein. Now, when we're talking about a bacterial meningitis, obviously we're going to have increased white blood cells in the CSF. And increased white blood cells in the CSF will make the CSF cloudy. So you can be sure you can comfortably take out options C and D because they say the CSF is clear. You will not find a clear CSF in a bacterial infection. White blood cells will cause the CSF to be cloudy. Now, something else we need to pay attention to, we're going to use that to choose between option A and B because that's what we're left with. We've taken out C and D because of the clear CSF. We're left with option A and B. Something that we should also pay attention to is that bacteria feeds on glucose. So if there's a bacterial infection, glucose is going to be decreased. Option A and B talk about decreased glucose. That's fine. But then in a bacterial meningitis, you will also see that protein levels are high. All right, protein levels will be high. So, characteristics of a bacterial meningitis is a cloudy CSF, increased protein, and decreased glucose. And the only option that works here is option B. So, that will be our answer. Now, let's move to the next question. Question 29. A nurse is planning care for a child with acute bacterial meningitis. Based on the mode of transmission of this infection, which of the following would be included in the plan of care? Now, option A says no precautions are required as long as antibiotics have been started. Option B says maintain enteric precautions. Option C says maintain respiratory isolation precaution for at least 24 hours after the initiation of antibiotics. And option D says maintain neutropenic precautions. What do we do? How is bacterial meningitis transmitted? Bacterial meningitis is transmitted through respiratory droplets. So obviously, the answer here will be to maintain a respiratory isolation precaution, especially within the first 24 hours because even though we've started antibiotics by this time, this patient is still very contagious. So we want to protect against the means of transmission, which is respiratory in nature. So the correct answer here will be option C. Option A is incorrect, which says no precautions. Obviously, precautions are required because bacterial meningitis is contagious. Option B says maintain enteric precaution. This is unnecessary because enteric precautions will be used in situations where transmission is as a result of direct or indirect contact with fecal matter. Sorry, with fecal matter. So if we don't have any reason to pick option B because meningitis is respiratory in nature and not gastrointestinal. And then option D is also wrong because this neutropenic precaution is used in patients who have decreased or very low white blood cells. So A, B, and C do not apply to this question. The only answer that applies to this question is option C. Let's move on to the next question. A nurse is reviewing the record of a child with increased ICP and notes that the child has exhibited signs of decerebrate posturing. On assessment of the child, the nurse would expect to note which of the following if this type of posturing was present. 1. Abnormal flexion of the upper extremities and extension of the lower extremities. B. Rigid extension and pronation of the arms and legs. C. Rigid pronation of all extremities. And D. Flaccid paralysis of all extremities. Now, there are two main types of posturing when we have neurological deficits, right? And one is decorticate posturing, and the second is decerebrate posturing. In this case, the question is saying that this child presents a decerebrate posturing. So what would that look like? Now, a decerebrate posturing generally indicates that there is a problem with the brain stem. And this decerebrate posturing is characterized by complete extension, rigid extension of the extremities and pronation of the extremities, right? So the correct answer here is option B, because that is what explains or what characterizes a decerebrate posturing. Option A is wrong because option A is more of a decorticate posturing, and that's not what the question is asking for. And option C, a rigid pronation of all extremities. This posturing does not actually exist neurologically. And then flaccid paralysis of all extremities basically is the absence of muscle tone or activity. So the correct answer here, a decerebrate posturing is equal to rigid extension and pronation of the arms and leg. Correct answer here is option B. Now, next question says, which of the following assessment data indicates nuchal rigidity? Where have we heard of nuchal rigidity before? Think about that while I give you the options. Option A, positive Kenning sign. Option B, negative Brudzinski sign. Option C, positive Homan sign. And option D, negative Kenning sign. So back to my question. Where have we heard of nuchal rigidity before? We've heard of that in meningitis. And what did we say about meningitis? We said that in meningitis, there are three significant signs to look out for: a positive Kenning sign, a positive Brudzinski sign, and nuchal rigidity. So when in this case, this question tells us that it is related to meningitis because it is asking about nuchal rigidity. And now, of the two signs that we have in meningitis, which is the Kenning sign and the Brudzinski sign, the one that actually indicates that there is a nuchal rigidity is the Kenning sign. So a positive Kenning sign will indicate that there is nuchal rigidity. So the correct answer here is option A positive Kenning sign. Option B, a negative Brudzinski sign, is wrong. Option C, a positive Homan sign. You will see that in cases of deep vein thrombosis. And option D, a negative Kenning sign, is obviously wrong. So the correct answer here is A, positive Kenning sign. Let's move on to the next question. 32, again, we're talking about meningitis. Meningitis occurs as an extension of a variety of bacterial infections due to which of the following conditions? A, congenital anatomic abnormality of the meninges. B, lack of acquired resistance to the various etiologic organisms. C, occlusion or narrowing of the CSF pathway. And D, natural affinity of the CNS to maintain pathogens. Well, we've said about the transmission of or the cause of most meningitis, bacterial meningitis infection is mostly because of the spread of the infection through other parts of the body, especially and through structures that are very close to the meninges. Now, generally, this will have to do with the immune system of the individual. If the immune system of the individual is not able to defend the body against pathogens, then the risk of bacterial infections of the meninges occurs, right? So the correct answer here will be the lack of acquired resistance to the various etiologic organisms that is related to the immune system of the individual. Option A is wrong because a congenital and anatomic abnormality of the meninges will not increase susceptibility to infections of the meninges. All right, so that is not the correct answer. Option C, occlusion or narrowing of the CSF pathway, will not directly lead to meningitis. It will most likely cause hydrocephalus in this patient. And then natural affinity for the CNS to certain pathogens, which is option D. Even though the CNS has natural affinity to certain pathogens, that is not a direct cause of meningitis. So the best option here is option B, which is the lack of acquired resistance to the various etiologic organisms. Now let's move on to the next questions. We have three more questions to go. Which Of the following pathologic processes is often associated with aseptic meningitis? A. Ischemic infarction of cerebral tissues. B. Childhood diseases of viral causation such as mumps. C. Brain abscesses caused by a variety of pyogenic organisms. And D. Cerebral ventricular irritation from a traumatic brain injury. Now, this question is talking about aseptic meningitis. The most common form of meningitis is the bacterial meningitis, but this is specifically asking us about the aseptic meningitis. Now, aseptic meningitis is primarily caused by viral infections, especially childhood viral infections such as mumps, measles, and herpes. So, the correct answer here will be option B. Childhood diseases of viral causation, such as mumps, they are the main cause of an aseptic meningitis. Option A is ischemic infarction of the cerebral tissue will not typically cause an aseptic meningitis. Option C, brain abscesses caused by a variety of pyogenic organisms. That is going to be as a result of bacterial infection, not viral infection. And when we talk about aseptic meningitis, we're mostly talking about viral infections. Option C is not the right answer. And a cerebral ventricular irritation from traumatic brain injury will not cause aseptic meningitis. A traumatic injury is more likely to cause a bacterial meningitis and not an aseptic meningitis. So the correct answer here is option B. Let's move to the next question. You are preparing to admit a patient with a seizure disorder. Which of the following actions can you delegate to LPN or LVN? LPN means licensed practicing nurse, and LVN means licensed vocational nurse. Option A, complete admission assessment. Option B, place a padded tongue blade at the bedside. Option C, set up oxygen and suction equipment. And option D, pad the side rails before the patient arrives. We're talking about a patient with a seizure disorder, and we're looking at which one of these actions here can be done by an LPN or an LVN without problems. Option A says a complete admission assessment. That is not correct because that will be the duty of an RN, a registered nurse, not an LPN, not an LVN. So that is wrong. B, place a padded tongue blade at the bedside. Now, this is not necessary. This is a prohibited action because we do not need a tongue blade in the case of a seizure. That is a prohibited action. Set up oxygen and suction equipment is a very correct action that can be delegated to LPNs and LVNs. And it is also something that is very important in the case of a seizure to help us clear out fluids or secretions that the patient cannot independently clear themselves to avoid aspiration. So the correct answer here that is option C. It is something that an LPN or LVN can do. D, pat the side rails before the patient arrives. Well, this action is still very controversial, and truthfully, it is not one of the job descriptions of LPNs. So the only option here that falls within the job descriptions of LPNs and LVN is to set up oxygen and suction equipment. And the last question for this part, if a male client experienced a cerebrovascular accident that damaged the hypothalamus, the nurse would anticipate the client has problems with A, body temperature control, B, balance and equilibrium, C, visual acuity, and D, thinking and reasoning. So this patient has had a cerebrovascular accident and damage has occurred to the hypothalamus. So if you do not know the function of the hypothalamus, it will be very difficult for you to answer this question. So the hypothalamus generally regulates body temperature. So any damage that occurs on the hypothalamus will alter the body temperature regulation because then there'll be problems with thermoregulation. So if a patient has a damage to a hypothalamus, the nurse will anticipate that the patient will have problems controlling their body temperature. So the correct answer here is option A. It wouldn't be balance and equilibrium because hypothalamus has nothing to do with balance and equilibrium. That is mostly a cerebellar function. Visual acuity is an occipital lobe function, and thinking and reasoning is mostly the cerebral cortex function. So the only option here that corresponds to a damage to the hypothalamus is altered body temperature or difficulty controlling body temperature. So the correct answer here will be option A. So that is the end. Female client admitted to an acute care facility after a car accident develops signs and symptoms of an increased intracranial pressure. The client is intubated and placed on mechanical ventilation to help reduce ICP. To prevent a further rise in ICP caused by suctioning, the nurse anticipates administering which drug endotracheally before suctioning. Option 1, phenytoin. Option B, mannitol. Option C, lidocaine. And option D, furosemide. So we've learned a lot about ICP and how we can reduce increasing ICP. So I'm sure many people are thinking the correct answer here is mannitol. Mannitol is very good for controlling ICP, right? But it is not possible to administer mannitol endotracheally. So the mannitol here, option B, is not the correct answer. Now, phenytoin is used to control seizures, but it is not going to help us reduce ICP. Lidocaine, on the other hand, can be administered endotracheally, and it is used to reduce the increased ICP that can be caused by suction. And remember that this nurse is about to do a suctioning procedure on this patient. And so what she's trying to control is the increased ICP that can result from the suctioning. So our correct answer here is lidocaine, because lidocaine will help reduce that increased ICP that can be caused by suctioning. And then furosemide is a diuretic, which is used to reduce fluid volume, but it's not necessarily going to manage ICP in this case. So the correct answer to this question is option C, lidocaine. Now, next question. After striking his head on a tree while falling from a ladder, a young man aged 18 is admitted to the emergency department. He is unconscious and his pupils are non-reactive. Which intervention would be the most dangerous to the client? Okay. Option A, give him a barbiturate. Option B, place him on a mechanical ventilation. Option C, perform a lumbar puncture. And option D, elevate the head of his bed. Now, this patient is 18. He has hit his head while falling from a ladder. He's unconscious and his pupils are not reactive. What does this tell us? In a patient like this who has had a head trauma and is unconscious, we can suspect that ICP might be increased in this patient. And because we have that suspicion, we have to be careful with a lumbar puncture, because as we know, if you do a lumbar puncture in a patient who has an increased ICP, there is a very high risk of brain herniation, which can lead to neurological damage and even death. Now, this brain herniation is because of the sudden drop of pressure around the brain that happens when you do an LP. So in case, as usual, a CM or discard an increased ICP before proceeding with an LP. The most dangerous thing you could do for this client right now is to do an LP. So the correct answer here is option C. Giving him a barbiturate, which is option A, will control seizures, reduce metabolic demand, but it's not the most dangerous thing you can do to this patient. B, placing this patient on mechanical ventilation is very necessary because we need to manage airway and breathing, so that is not dangerous to the client. And option D, elevating the head of his bed, is a standard procedure because this will help reduce intracranial pressure. So option D is not a dangerous procedure for the client. The only dangerous thing we can do for this client at the moment is perform an LP. So correct answer here is option C. Now, next question. When obtaining the health history from a male patient with retinal detachment, the nurse expects the client to report A. Light flashes and flutters in front of the eye. B. Recent driving accident while changing lanes. D. Headaches, nausea, and redness of the eyes. And D. Frequent episodes of double vision. Now, this patient is suffering from a retinal detachment. A retinal detachment means that the retina is pulling off from the underlying supportive tissues. And retinal detachment are characterized by light flashes, which is called photopsia, and floaters, right? So the correct answer here is option A. Light flashes and floaters is what you would see in a patient having retinal detachment. Option B is wrong, common to glaucoma, because this will suggest to us a loss of peripheral vision. All right, so option B will be as a result of glaucoma, not retinal detachment. Headaches, nausea, redness of the eye is option C. These symptoms are very much characteristic of acute angle closure glaucoma, not retinal detachment. And option D, frequent episodes of double vision, that is not a typical symptom you'll find in retinal detachment. You'll find that in issues of cataracts or other neurological disorders that are not retinal detachment. So the correct answer here will be A. Light flashes and flutters, they are very common in retinal detachment. Next question. Which nursing diagnosis takes highest priority for a client with Parkinson's crisis? Option A, imbalanced nutrition, less than body requirements. Option B, ineffective airway clearance. Option C, impaired urinary elimination. And option D, risk of injury. Now, when a question is asking us for the highest priority, it means that all the options are correct, okay? But one of the four options is the most important or is of higher priority than the others. And that's what this question is asking us to identify. Now, in a patient with Parkinson's crisis, in a severe case of Parkinson's crisis, this patient is going to have significant immobility and a lot of drooling, excessive drooling. And like we've learned before, this excessive drooling increases the risk of aspiration and airway obstruction, which for us should be a priority, because in every emergency, our first thing to do is to do the ABC. So we want to make sure that airway and breathing are secured. So in this patient Parkinson's crisis, we're going to see excessive drooling, which will increase the chances of aspiration and airway obstruction. So our highest priority here is to make sure that airway clearance is very effective in order to prevent a life-threatening complication such as aspiration pneumonia. All right, so that would be our answer, option B. The highest priority here is an ineffective airway clearance. Option A is imbalanced nutrition. Obviously, we are very worried about this patient's nutrition, but that's the imbalanced nutrition is not a life-threatening condition at the moment. We're also worried about impaired urinary elimination, but again, that is not a life-threatening situation that could be fatal to this patient in that moment. And obviously, the risk of injury is high and it's a very big concern for us. But again, if we can secure airway, then we can focus on the other options here. So the answer here will be option B, ineffective airway clearance. Next question says, the nurse has given the male patient with Bell's palsy instructions on preserving muscle tone in the face and preventing denervation. The nurse determines that the client needs additional information if the client states that he or she will A. Wrinkle the forehead, blow out the cheeks, and whistle. Option B. Massage the face with gentle upward motion. Option C. Perform facial exercises. And option exposure to cold and drafts. I'm going to go ahead and explain a little bit more about this question while you think of an answer. So, this is a scenario where a patient has had Bell's palsy, right? The nurse is giving this patient instruction, telling the patient what to do to improve muscle tone and to prevent nerve damage. But every time we give a patient an instruction, it's important for us to ask questions to these patients to know if they've understood the instruction we've given them. That way, we can know if we need to give them additional information or if they have correctly understood what information we've given them. So this is the case here. Now, this nurse is trying to find out if this patient understood the instructions she gave him or her. Now, based on the answer of the patient, the nurse will know if this patient had fully understood. But this question is telling us here that one of these four options is the answer of the patient that indicates to the nurse that she needs to give this patient additional information because this patient has not quite understood the instructions the nurse gave him. So now let's look at the options we've seen here. When we talk about Bell's palsy, remember that the muscle tone is affected because there is a facial paralysis. And so, to improve that muscle tone, facial exercise, massage, and warmth are recommended. Now, exposing your face to cold and draft is prohibited. It will exacerbate Bell's palsy and it should be avoided at all costs. So, it is never an indication to a patient with Bell's palsy to expose their face to cold and drafts. So if the patient says, I will expose my face to cold and draft, that's a sign that the nurse has to explain him or herself again, give these instructions again, and give additional information so that the patient understands. Option A, B, and C are very correct measures. So if the patient said any of that, then the nurse could be at peace and know that this patient understood. The only reason why the nurse will have to give additional information is option D. Wrinkling of the forehead, blowing out the cheeks, and whistling, which is option A, is going to be a very good exercise to help recover muscle tone. Massaging the face with a gentle upward motion is also good for maintaining the muscle tone and reducing discomfort. And performing facial exercises is very recommended for improving muscle tone. So our answer here is option D. Our next question says, a female client is admitted to the hospital with with a diagnosis of Guillain-Barre syndrome. The nurse inquires about the nursing admission interview. If the client has The nurse inquires during the nursing admission interview if the client has a history of A. Seizures or trauma to the brain, B. Meningitis last 5 years, C. Back injury or trauma to the spinal cord, and D. Respiratory or gastrointestinal infection during the previous month. Now, if you know anything about Guillain-Barre syndrome, you know that it is a neurological syndrome that is mostly a result of certain types of infections, especially respiratory and gastrointestinal infections. So this is related to immune response. So the studies show that Guillain-Barre syndrome is developed when the immune system tries to respond to this respiratory gastrointestinal infection and ends up causing peripheral nerve damage to the client, therefore leading to paralysis of this progressive paralysis of this patient. Now, so commonly Guillain-Barre syndrome is related to infections like respiratory or gastrointestinal infections. So the correct answer here is option D. Seizures or trauma to the brain are not related to GBS. Option meningitis during the last 5 years is also not a precursor of GBS. And back injury or trauma to the spinal cord is not a typical precursor of GBS. So GBS is related to option D, respiratory and gastrointestinal infection. If you have a patient and you're suspecting GBS in them, you need to find out if they've had a recent respiratory or intestinal infection during the previous months. GBS is also known to occur in relation to certain vaccines. Next question. A female client with Guillain-Barre syndrome has ascending paralysis and is intubated and receiving mechanical ventilation. Which of the following strategies would the nurse incorporate in the plan of care to help the client cope with this illness? A. Giving the client full control over care decisions and restricting visitors. B. Providing information, giving positive feedback, and encouraging relaxation. D. Providing intravenously administered sedatives, reducing distractions, and limiting visitors. So it's important for us to know that in Guillain-Barre syndrome, there is a sudden paralysis that happens, and this tends to cause anxiety and fear in this patient. So what this patient will need will be information, positive feedback, support, encouragement. This will help them to reduce the anxiety and also help them cope with their current condition. If we involve family members in care activities, that could also help them feel supported and reassured. So, which one of these options is the best way for this client to cope with their illness? Let's look at option A, giving the client full control over care decisions and restricting visitors. We want to involve the patient in making decisions in their care, right? But giving them full control and restricting visitors is not going to be beneficial to them. So option A is out. B, providing positive feedback and encouraging active range of motion. Correct. We want to give them positive feedback, but we cannot encourage active range of motion because this patient has a significant paralysis. So option B is also out. Option C, providing information, giving positive feedback, and encouraging relaxation. This will help the patient better and cope better with their condition. So the correct answer is C. We want to provide them with all the information that they need. We want to give them positive feedback and we want to encourage them to relax. Option D is wrong because having them sedated the entire time and limiting visitors is not going to help them in any way. So the best option here is option C. Next question. A male client has an impairment of cranial nerve 2. Specific to this impairment, the nurse would plan to do which of the following to ensure the client's safety? Number one, speak loudly to the client. Number two, test the temperature of the shower water. Number three, check the temperature of the food on the delivery tray. And number four, provide a clear path for ambulation without obstacles. If you do not know what the cranial nerve 2 is and does, then you would not be able to answer this question. All right. So the cranial nerve 2 is the optic nerve, which is in charge of vision. So vision. So option A, speaking loudly to this client is very unnecessary because the client's ears are fine. The problem is the vision. And then option B, test temperature. Basically, those are procedures we use to prevent burns, right? And this patient has very good sensory function. The only thing affected here is the vision. So testing for temperature is unnecessary. Option C, checking for the temperature of food, again, is very unnecessary. The correct answer here is to provide a clear path for ambulation without obstacles. Ambulation is movement, okay? For them to be able to move, we need to create a clear path because they are having problems with their vision. So that would be the correct answer. Now let's move to the next question. A female client has a neurological deficit involving the limbic system. Specific to this type of deficit, the nurse would document which of the following information related client's behavior. Option A is disoriented to person, place, and time. Option B, affect is flat with periods of emotional lability. C, cannot recall what was eaten for breakfast today. D, demonstrates inability to add and subtract and does not know who the president is. Now, for you to be able to, limbic system regulates our emotions and our affect. So anything that causes damage to the limbic system is going to affect the way we express our emotions and affect. So what you're going to see in a patient who has problems with the limbic system is a flat affect and emotional ability. So the correct option here is option B. A, that says that this patient is disoriented in person, place, and time. Well, that is something that is mostly related to the cerebral hemisphere. If there were to be a damage in the cerebral hemisphere, then we would see that level of disorientation. It is not specific to the limbic system. Option C, cannot recall what was eaten for breakfast. So we're talking about recent events. That would be related to the hippocampus. So not something that the limbic system will focus on. And then D, inability to add and subtract. Now that is something that is related to the frontal lobe. So not the limbic system. The only thing here related to the limbic system is option B, affect is flat with periods of emotional lability. Next question. A patient is diagnosed with Sturge-Weber syndrome. What is a key characteristic of this condition? A, dysfunction of the trigeminal nerve leading to severe sharp facial pain. B, non-progressive neurological disorder causing facial paralysis on one side. C, rare degenerative brain disorder with sudden onset of progressive neurological symptoms. And D, neurocutaneous disorder with angiomas causing skin, brain, and eye abnormalities from birth. Now, even if you do not know what Sturge-Weber syndrome is, every option here is a diagnosis, is a specific condition. So if we can look for the diagnosis of each option, then we can keep eliminating the options that are not correct until we find the option that actually explains the symptoms of Sturge-Weber syndrome. So, so let's start from option A. Dysfunction of the trigeminal nerve leading to severe sharp facial pain. That is very characteristic of trigeminal neuralgia. So that obviously is not Sturge-Weber syndrome. We can take out option A. Option B says non-progressive neurological disorder causing facial paralysis on one side. That is very typical of Bell's palsy. So we can obviously take off option B because that's not Sturge-Weber syndrome. Now we're left with option C and option D. Option C says a rare degenerative brain disorder with sudden onset of progressive neurological symptoms. Now, this is very characteristic of CJD, which is the Creutzfeldt-Jakob syndrome, right? And this would generally cause dementia in these patients. So that one is also out because it's not Sturge-Weber. Option D says neurocutaneous disorder with angiomas causing skin, brain, and eye abnormalities from birth. That is the correct answer. If you don't know anything about Sturge-Weber syndrome, it is important for you to know that Sturge-Weber syndrome is a congenital condition. So the only congenital condition here in these four options is option D. So that will be best bet. So the correct answer here is Sturge-Weber syndrome, which is a congenital disease that affects people and is characterized by these angiomas on the skin, the brain, the brain blood vessels are also injured. We have like a characteristic port wine birthmark the face of this patient. And also, these eye abnormalities that they experience is very similar to glaucoma. So that will be your correct answer, option D. Now, let's move to the next question. A patient with a spinal cord injury presents with lightheadedness, flushed skin above the injury, injury site and a headache. Blood pressure is 160 over 90 millimeter mercury. What should the nurse do first? We have four options here. Option A says loosen tight clothing or accessories. Option B says check for bladder distension. Option C says elevate the head of the bed. And option D, administer an antihypertensive. Now, it is important for us to know that we are in the presence of an autonomic dysreflexia. And in this case, we're having your autonomic nervous system being hyperreactive. Remember that the autonomic nervous system will control involuntary actions such as breathing, blood pressure, digestion, amongst others. So an autonomic dysreflexia is a hyperreaction of your autonomic nervous system. It is characterized by four important signs. One, it is common in people who have had or who have spinal cord injury. This patient is going to have headaches. This patient is going to have a skin flush on the site of the injury around the spine, and blood pressure will be very high. Now, all of these things, all of these options we have here are very correct. They are very correct options to consider in a patient with autonomic dysreflexia. But the question is telling us asking us what should the nurse do first. So which one of these four options is a priority? Now, to loosen tight clothing is fine. Checking bladder distension is fine. They are all fine. But in the case of autonomic dysreflexia, the first thing we have to do is to elevate the head of the bed, because this will help control the blood pressure and prevent a hypertensive stroke. Then after that, we can loosen tight clothing and accessories. We want to check for bladder distension after that, because most times bladder distension is the trigger of autonomic dysreflexia. And then if it's necessary, we can administer a antihypertensive medication. But first things first is to elevate the head of the bed. So the correct answer here is option C. Now let's move to the next question. A post-stroke patient frequently bumps into objects on one side and has trouble reading the start of new lines. What condition is this? A, visual neglect, B, astigmatism, C, blepharitis, and D, homonymous hemianopsia. So this patient has had a stroke, right? And now they're frequently bumping into objects just on one side of their visual field, and now they're having problems to read the start of new lines. Let's look at each option. Visual neglect is more of an attention issue and not a visual field problem, so that is out. Astigmatism is as a result of the irregular shape of the cornea, and it will be characterized mostly by blood vision, so that is out. Blepharitis is just an inflammation of the eyelid, so it has no reason to affect your visual field, so that's out. So we've taken out option A, option B, and option C. The correct answer here is option D, homonymous hemianopsia, which is as a result of loss of half of your visual field. And this is as a result of strokes, as a result of brain tumors, or as a result of brain trauma. So correct answer here is homonymous hemianopsia. Next question is, for a patient with increased intracranial pressure from a brain hemorrhage, which treatment is inappropriate? A, acetaminophen, B, dexamethasone, C, mannitol, D, phenytoin, and E, nitroglycerin. So this is a patient with increased intracranial pressure as a result of brain hemorrhage. Which treatment is inappropriate? Which of these five treatments should not be administered to this patient? Now, acetaminophen is a good treatment to administer to this patient because it will help control fevers. Dexamethasone is also a very good medication to give to this patient because it will create a balance, or it will stabilize the brain cell membranes, and it will reduce this blood-brain barrier leakiness. So dexamethasone is safe to administer to this patient. Mannitol we know Mannitol now, we know that it drains liquid from the brain and reduces intracranial pressure. So it's a very good medication to give to this patient. Phenytoin, remember that people with increased intracranial pressure tend to have seizures. So phenytoin will control seizures, and so that's a good medication to administer to the patient. Nitroglycerin is a vasodilator, which will cause the intracranial pressure to increase even more. So the inappropriate treatment here is nitroglycerin. Correct answer is option E. Next question. What symptom would indicate a phenytoin level of 35 milligram DL in a patient? Now, we've talked about this in one of the other questions. Phenytoin is used to control seizures, right? And the normal level for phenytoin in the blood is between 10 to 20 milligram per deciliter. So anything that is above 20 is a phenytoin toxicity. Phenytoin toxicity is characterized by ataxia, tremors, slurred speech, and nausea and vomiting. So which of these options here will indicate there is phenytoin toxicity in this patient? A, ataxia, B, potassium deficit, C, neglect syndrome, and D, tetraplegia. The correct answer here is ataxia, because that is one of the symptoms of phenytoin toxicity. Let's move to the last question. The medical team is evaluating a patient admitted with a diagnosis of hemorrhagic stroke affecting the right side of the brain. Which clinical finding aligns with this diagnosis? Now, this is a patient who has had a hemorrhagic stroke on the right side. When we talked about hemorrhagic stroke in the overview in our first video, we talked about the fact that the symptoms of a hemorrhagic stroke will depend on what side of the brain is affected. We said that if the hemorrhagic stroke occurs in the mostly dominant part of the brain, which is the left side, we'll have symptoms on the right side of this patient's body, and vice versa. In this case, our patient has had a hemorrhagic stroke affecting the right side of his brain. So we should see our symptoms, most of our symptoms, on the right side. So option A says weakness on the left side, B says positive Kenning sign, C says spasticity in the right side, and D says presence of Babinski sign on both sides. Let's go from bottom to top. Hemorrhagic stroke, when we talked about it, we did not talk about presence of Babinski sign on both sides. So that is not a sign that is typical of hemorrhagic stroke. Spasticity on the right side, well, as we already said, the spasticity should be on the left side because the right side of the brain is what was affected. B, a positive Kenning sign is wrong because we'll see a positive Kenning sign in the case of meningeal irritation, such as meningitis. So we are not in the presence of meningitis. Option B is out. So we've taken out option B, C, and D. The correct answer here will be weakness left side of the body because the hemorrhagic stroke occurred on the right side. So our correct answer here is option A. So this is all we have for answering NCLEX stroke questions, and I hope that this session has been very helpful to you all. And make sure to go through all the 3 videos as many times as possible. And if you have any questions, you can check out more of our videos. Thank you for your time, and bye.